Hi, my name is Miles Terrell, and I will be presenting on alcohol use disorder, focusing specifically on its impacts in North Carolina. I will be examining both the individual and societal effects while exploring interdisciplinary approaches to addressing the significant public health challenge. The Diagnostic Statistical Manual of Mental Disorders, 5th edition, otherwise known as the DSM-5, defines alcohol use disorder as a problematic pattern of alcohol use leading to clinically significant impairment or distress. The severity of AUD is determined by the number of criteria met. Mild would be 2 in the 3 category, moderate would be 4 to 5 criteria, and severe would be above a 6. Additional, Additionally, the DSM-5 criteria not shown on this slide includes spending significant time obtaining, using, and recovering from alcohol, developing a tolerance, giving up important activities because of alcohol, and unsuccessful attempts to cut down or stop drinking. When discussing these criteria, emphasize that AUD exists on a spectrum and requires professional diagnosis. These are simplified versions of the clinical criteria. These statistics come from the North Carolina Department of Health and Human Services and CDC reports on alcohol consumption patterns. Binge drinking is defined as consuming 5 or more drinks in men or 4 or more drinks in women on a single occasion. The mortality rate highlights the disproportionate impact on male populations, suggesting targeted interventions may be necessary. The economic cost includes healthcare expenses, lost productivity, criminal justice costs, and motor vehicle crashes. These numbers demonstrate that AUD is not just a personal health issue, but a significant public health and economic concern for the state. The enabling cycle represents how family members and loved ones can inadvertently perpetuate alcohol use disorder through well intentioned actions. Research shows that breaking this cycle often requires professional intervention and family therapy. Studies indicate that up to 60% of families engage in some form of enabling behavior. I can attest to this as I have witnessed my grandmother enabling my cousin. I know that the enabling comes from a place of love and concern. This slide examines how alcohol use disorder, or AUD, perpetuates systemic inequalities in our society. Criminalization versus treatment. People with lower socioeconomic status are more likely to face jail time for alcohol-related offenses rather than receiving treatment. This creates a cycle where incarceration leads to unemployment, which increases homelessness risk and further substance use. Healthcare disparities. Many North Carolinians, especially in rural areas, face treatment deserts with no nearby rehabilitation facilities. Insurance coverage for addiction treatment varies widely, creating significant barriers for low-income individuals. Positional factors. Research shows racial disparities in AUD treatment outcomes and criminal justice responses. Gender differences affect both prevalence rates and treatment approaches. The narratives of marginalized communities are often excluded from mainstream addiction discourse. North Carolina has implemented several key initiatives to address AUD across the state. Government proclamations. The state officially recognizes April as Alcohol Awareness Month, which helps raise public consciousness and reduce stigma around AUD. These proclamations provide visibility and legitimacy to prevention efforts. The STOP Act. The Strengthened Opioid Misuse Prevention Act also contains provisions for alcohol regulation. This legislation increased penalties for businessmen selling to minors and enhanced ID verification requirements. Research shows that these measures have reduced underage drinking rates by approximately 15% since implementation. Research centers. The Bowles Center at UNC Chapel Hill is nationally recognized for its groundbreaking research on the biological mechanisms of AUD. Their work informs both treatment protocols and public policy decisions across the state. Collaborative approach. North Carolina's success comes from bringing together multiple stakeholders. Healthcare providers develop treatment protocols, policymakers secure funding, and educators implement prevention programs in schools and communities. North Carolina's strategy targets youth and young adults as the primary demographics for AUD prevention and intervention, recognizing that addiction patterns often begin during these formative years. Prevention focus. Research shows that interventions before age 21 are 4 to 5 times more effective than later treatment. Brain development continues until age 25, making youth particularly vulnerable to developing substance dependencies. Education campaigns. Programs like Talk It Out in North Carolina provide age appropriate materials for different development stages. These campaigns have reached over 75% of North Carolina high schools and have been correlated with a 12% reduction in underage drinking incidents. Support networks. Peer support groups in schools and universities create safe spaces for young people to discuss alcohol related pressures. Community mentorship programs connect at risk youth with positive role models who model healthy coping mechanisms. Policy protection. The STOP Act strengthened penalties for businesses selling alcohols to minors. Additionally, college campus polices limiting alcohol marketing and availability have shown measurable success in reducing binge drinking rates. This pyramid approach builds a comprehensive safety net for young people, addressing AUD through multiple complementary strategies rather than isolated interventions. This slide represents my personal journey towards understanding AUD as a multifaceted issue requiring interdisciplinary solutions. Complex problem. My research across psychology, sociology, and public health revealed how fragmented our understanding of AUD often is. Medical models focus on biological dependence, while social approaches emphasize environmental factors, and psychological perspectives highlight cognitive patterns. None alone provide a complete picture. Personal connection. My family's experience with my cousin's AUD showed me how theoretical knowledge transforms when applied to real situations. I observed firsthand how family members, despite good intentions, can perpetuate cycles of addiction through enabling behaviors. This personal connection deepened my academic understanding. Multidisciplinary solution. The most effective intentions I've studied the most effective interventions I've studied and observed combine medical treatments, psychological approaches, social support networks, and family therapy. Recovery is rarely linear and requires addressing all dimensions simultaneously. These key takeaways synthesize our discussion of AUD as a multifaceted challenge requiring interdisciplinary solutions. Successful interdisciplinary interventions that combine medical treatments, psychological approaches, and social support networks should be utilized. Highlight research showing significantly higher recovery rates when multiple approaches are coordinated. Connect to North Carolina's specific challenges and how interdisciplinary approaches are being implemented locally, and remind the audience that effective interventions balance individual responsibility with systemic support. This slide bridges our discussion of specific interventions to our conclusion, reinforcing the central theme of interdisciplinary collaboration.